Dr. Julie Boom, and I'm Director of the Immunization Project at Texas Children's Hospital. Flu has already started to increase in the state of Texas, so we wanted to give you the latest information about flu across the state and across the nation. So this year we're actually starting to see an H3N2 flu season. In prior years we've seen mostly H1N1, but this year it's mostly H3N2 so far. And that strain emerged in about March of this year and is slightly different than the vaccine strain. It's actually really important that we go ahead and use the vaccine that we have, because we know that sometimes we'll get good cross protection between the type that is in the vaccine and these drifted strains. So it's super important that we go ahead and continue to vaccinate with both the nasal vaccine and the injected vaccine, with the hopes that it will offer good protection with the vaccine strain and the drifted strain. There's been some data released recently that the nasal vaccine did not have good effectiveness in this last year for the 2013-14 flu season. And some of you may think, well, maybe I shouldn't be using the nasal vaccine. But so far the CDC has not changed their recommendation about using the nasal vaccine. So as providers, we're supposed to still continue to offer both the nasal vaccine and the shot vaccine. And in fact, the nasal vaccine in prior years has actually been shown to have better cross protection actually at times than the shot has. So now that we have the drifted vaccine, it's actually potential that it could be that the nasal vaccine will actually have better opportunities for cross protection. So go ahead and vaccinate with whatever you have in your office, nasal, shot, what the parents are interested to take, or what is the best in the best interest of that child. This year it's going to be especially important to think about using antiviral medications like Tamiflu in your patients who have been sick for less than 48 hours with influenza-like symptoms. I really encourage providers to go to the DSHS website. They actually send out weekly emails about all of the influenza-like illness across the state of Texas and the viruses that we're seeing. That's a great way to stay up to date on what's going on in our state. The CDC also has a wonderful website about influenza, so that's a great way to stay up to date about what's going on across the nation. If you have families that have concerns about giving influenza vaccine either to themselves or to their child, the CDC also has great information. I also encourage you to look at the Families Fighting Flu website, and they have very powerful information about the importance of flu vaccine in children. Thank you so much for taking the time today to learn more about the influenza vaccine. If you have any questions, please feel free to call me, Dr. Julie Boom, at the Immunization Project, 832-824-2064.